Well, the number of young people that have died from a drug overdose in Wisconsin quadrupled over the last 12 years, according to a new report. News 8's Kyle Dimke now joins us with a look at if that same trend is taking place locally.
Well, Martha, that report says Wisconsin is one of 5 states that has seen the number of people aged 12 to 25 dying from a drug overdose skyrocket. But in La Crosse County, things are looking a bit better. Health educator and co-chair of the La Crosse County Heroin and Illicit Drug Task Force, Al Bliss, says he isn't surprised that Wisconsin has one of the highest rates in the country of drug overdose deaths among young people.
We look at the numbers from the state report. It does show that opioids have risen, but heroin by far is definitely quadrupled.
A report from the nonprofit Trust for America's Health shows between 1999 and 2013, the number of deaths in Wisconsin caused by a drug overdose among those ages 12 to 25 quadrupled. The report argues the rates are increasing partly due to the overprescription of painkillers. And a quick look at the Wisconsin Prescription Drug Monitoring Program website shows that in 2013, doctors and pharmacies in Wisconsin dispensed enough monitored prescription drugs to medicate the entire population of Wisconsin for nearly 40 days.
When we talk about young people, most of those that are being hospitalized for opioid hospitalization are individuals who they were not prescribed the medication by their physician, so they're abusing those prescription drugs.
In La Crosse County, there have been 3 overdose deaths this year, but none between the ages of 12 and 25. Medical examiner Tim Kandal says in recent years, heroin and meth have been the 2 drugs where he has seen the most overdose deaths, but prescription drugs are on his radar.
So the prescription medications, it's a big issue. But I'm not seeing the numbers, but I know it's being abused.
Kandal says the number of overdose deaths in the county has gone down in recent years, thanks largely in part to the overdose reversal drug Narcan.
With the Narcan on board, I think it greatly has improved the cases coming to my office. I really feared what would happen if we didn't have Narcan on board because obviously we would be seeing a lot more than what we have now.
And County Health Educator Al Bliss also says if you look at the results from the Youth Risk Behavior Survey, which was taken by more than 3,000 high school students in La Crosse County this year, the number of those students who reported using a prescription drug to get high is below the state and national average.
All right, thanks a lot, Kyle. This trend is not only in Wisconsin. The number of overdose deaths among the same age group tripled in 12 states, including Minnesota.